a lockdown. Are you considering putting in place a lockdown in New York City, or are you considering having restaurants and bars shut down in New York City?
Brianna, every option is on the table in a crisis that's one, we've never seen anything like this. Let's be clear. This is a crisis that will be with us, first of all, I believe at least 6 months.
Police driving down Bourbon Street in New Orleans, enforcing the ban on large gatherings, telling people to go home. Bars and restaurants across Ohio and South Boston are closed tonight. Colorado's governor ordering all downhill ski resorts to shut down, and the Academy of Country Music Awards are postponed. Walmart is cutting back on 24-hour stores, closing for 7 hours per day to restock shelves. Churches across the world are live streaming their services today, and the Vatican announced that crowds will be banned at all Holy Week celebrations next month.
This is unprecedented. This is unlike anything that we've ever seen. 24-hour Walmart stores closing. Of a period just to be able to restock their shelves. Unbelievable. Unbelievable.
We have a team of amazing experts with a lot more insight. Dr. Leana Wen is the former Baltimore Health Commissioner and a visiting professor at GW School of Public Health. Dr. Sue Varma is a clinical assistant professor of psychiatry at NYU Langone Medical Center. Ann Gearin is the White House correspondent for The Washington Post and an MSNBC contributor. And Gabby Orr is the White House reporter for Politico. All right, thank you all so much for being here. Dr. Wen, we have heard a lot about social distancing, and yet I do not believe that we can hear enough. Make the case for us once again for why this is so critical in this moment in the next 10 to 12 days.
We know that there is already community spread of coronavirus here in the U.S., that there are probably hundreds, thousands, maybe even tens of thousands of undiagnosed cases here. We're about to see an exponential rise, including in the number of patients who need intensive care unit beds and ventilators. Well, our hospitals just simply don't have that kind of capacity. The best way that we can prevent overwhelming our healthcare system and forcing doctors and nurses to ration healthcare is to reduce the rate of that spread right now, so-called flattening the curve, meaning that there is something that each of us can do right now in order to reduce the rate of transmission over the next few weeks. And that's where social distancing comes in, that we need to stay at home. Basically, any of us who can and don't have to go to work should stay at home. We should avoid large gatherings. And this does not apply only to those who are the most vulnerable, the elderly and those with chronic medical illnesses. This applies to all of us because we can all potentially transmit COVID-19 to other people. And therefore, our individual actions will make a big difference in changing the trajectory of this disease.
Dr. Varma, I want you to pick up there because I think everyone at home knows someone who has been resistant to that messaging, who is saying, I'm still going to go out, I'm still going to live my life exactly as before. If you have someone that you are trying to persuade that they need to be a part of this effort, how do you approach them? Dr. Varma,
you should be able to flatten that curve by everybody taking responsibility. And I think it's so important that each of us recognize that even if we're helping, look, I love the fact that people have an attitude of wanting to preserve their normal life as much as possible, but we can't continue the way that we normally are. So I think that we have to respect the fact that this is our new normal. But at the same time, try to live indoors, within means, whatever that's possible, with exercise, with movement, with mindfulness, whatever we can do.
And Vice President Pence is going to be leading a press conference in less than an hour. Do you have a sense of what we can expect to hear from the Vice President?
Yes, Alicia, we think that they will probably be announcing at least a couple of new initiatives from the White House podium today, having to do with availability of tests. And certainly the vice president or President Trump, if he makes an appearance and his Twitter today suggests that he might, they will get a lot of questions about the long lines and the congested conditions and the lack of planning involved for returnees at U.S. airports today. The pictures you showed a short while ago, that is a situation being replicated at a dozen or more airports across the country, and certainly that will be a major focus for the White House reporters asking the president, the vice president, and members of the task force why that happened and was it medically necessary.
Gabby, I want you to pick up where Ann just left off. The president tweeted after all the coverage of the lines at airports saying, "We are doing very precise medical screenings at our airports. Pardon the interruptions and delays. We are moving as quickly as possible, but it is very important that we be vigilant and careful. We must get it right. Safety first." Do you have a sense of the answers you're going to hear from this administration about why we are seeing those images?
It's extremely difficult to anticipate what they're going to say in response to this, partly because the images that we're seeing out of a number of airports, primarily O'Hare Airport in Chicago last night, are a direct result of the policies that this administration has put in place to respond to this viral outbreak. The president, of course, announcing suddenly that all U.S. travelers coming in from Europe, all foreign travelers coming in from Europe, would either be banned or have to face screening as they enter the U.S., and that's what led to those lengthy lines at customs and at baggage claims at the airports last night. And I do think that they're going to have to give answers as to what Ann was talking about earlier, as to whether or not this is posing a public health risk to the Americans and to foreigners who are in these airports right now in these crowded conditions. I think that's one of the answers that we're really hoping to hear from the White House today, how they're actually addressing this problem, how they are going to implement some type of social distancing to the degree that they can at a number of U.S. airports to minimize the risk to Americans.
Dr. Wen, you have New York's governor writing an op-ed today urging the president to mobilize the military to set up temporary medical centers. Your take?
We know that we're going to be over capacity in our hospitals. Actually, I'm hearing from my colleagues all around the country that their ERs are already being crowded with the so-called worried well, people who really don't need emergency care but are there because they're concerned about coronavirus. Well, please do not go to the ER unless you really need emergency care, because we need to save those ER beds and hospital beds for people who truly are ill. And still, we are going to run out of space. And so the more that we can build up capacity in the hospitals, the better. But there are also things that each of us can do right now to prevent the transmission of the disease to others. And so stay at home as much as you can.
So, Dr. Wen, I want to get your take on that, because Republican Congressman Devin Nunes went on Fox this morning to urge people to go out to eat. Take a listen.
There's a lot of concerns with the economy here because people are scared to go out. But I will just say, one of the things you can do if you're healthy, you and your family, it's a great time to just go out, go to a local restaurant.
Yeah.
Likely you can get in easily. Let's not hurt the working people in this country.
Dr. Wen, is that messaging dangerous?
Very much so. It's exactly the opposite of what we should be doing right now. We should be staying down, staying at home, hunkering down. We should be preventing the spread of this disease, because COVID-19 is spread from person to person. So if we stop the transmission person to person, that's how we're going to curb this illness, or else we're going to see a large escalation in this country.
And I have to pick up there and say a new NBC News Wall Street Journal poll out today says that 60% of Americans feel that the worst is yet to come. But there is a clear partisan divide, with that number being 79 for Democrats and 40% for Republicans. How does that reality then play out in what we see from the White House on Capitol Hill in this coming week?
Well, I think, Alicia, you're seeing something here that we haven't had to deal with in past public health crises. I mean, disease is not a partisan issue. You can get it whatever political party you support, whether you believe that President Trump is doing a good job or not, you can still get it. And the fact that the White House is not sort of getting ahead of that. And the president, although he is actually, out there talking just about every day about ways that the administration is trying to confront this crisis, we don't see from the president and the vice president directly messaging to the most loyal Trump supporters saying, look, you actually do need to listen to NBC News. You need to read the Washington Post. You need to pay attention to reliable national reporting that tells you exactly how widespread this disease is and ways that you can keep yourself safe. We have a story today interviewing people across the country and on just that point that your polling touches. And it was really dispiriting to see people in conservative parts of the country say that they think that they should go out and that they should go to church and that they should do things in public because not doing so is giving in to liberal hype. It's not. Not doing so is keeping yourself safe.
All right, Dr. Wen, Dr. Varma, Ann, and Gabby, thank you all so much. After the break, we're going to talk about what they're doing on Capitol Hill. Where does the relief bill stand? And is it just the start of what's needed from Congress? Plus, there's a debate tonight in Washington, and
Good luck to all of us. Good luck to each and every one of us.